What is Cosmetic Dentistry Lite, and how is it different from a full smile makeover?
You know, I love cosmetic dentistry. I love smile makeovers. I love veneers. I love the ability that we have to totally transform someone's smile. But at the same time, I don't think that's for everyone. You know, as we've been doing this and getting more and more into the aesthetics and the cosmetic dentistry side of things, the biggest thing I've noticed is that not all patients want the home run. Not all patients want the full smile makeover. And I think especially in the North Shore with, you know, in the Chicago area, you know, we're not Beverly Hills, we're not Hollywood. I'd say the biggest thing, and I don't know if you've seen this, but patients want natural looking teeth, right? Mm-hmm. And often one of the biggest fears, I think, in even getting any cosmetic dentistry done is they don't want to look fake. They want to look natural, they want to have their own teeth. And the thought of veneers, and I think some of the bad experiences that they've seen of some really poorly done veneers, keeps them from enhancing their smile. So, you know, what we've kind of come up with, which I think is the best fit for a lot of the patients that we see who are, you know, normal people that just want a smile enhancement, is this concept of Cosmetic Dentistry Lite. And it's kind of grown over the years and taken a form all on its own, where no longer is it just porcelain and full mouth makeovers and total rehabilitation of patient smiles, but it's more focusing on little subtle improvements. And so this concept that we've come up with, this Cosmetic Dentistry Lite concept that we've come up with, takes not your terrible smile, never liked the way they looked, missing teeth, total redo, but it gives kind of a middle ground to someone who just needs little tweaks and little improvements. So I think everyone wants their smile improved. Often people just say, you know, I want whitening or I want veneers, and no one's really tackled this middle ground where you can do more than just whitening, but you don't have to take it all the way to the veneer side of things. And we've had so many cases and patients that we've been able to do this with, where moving teeth just a little bit, right? So just getting teeth into a better position, doing some whitening to change the color a little bit, and then the biggest thing at the end when we do the aesthetic recontouring. And you know, all we're doing is essentially taking the teeth you have and adding some symmetry and changing, you know, little areas and shapes of teeth. And we're doing this so minimally invasively, where instead of, people see, I think on social media all the time, they're scared of getting crowns or veneers and they see these little pegs that they're left with. But, you know, we're not taking away an excess amount of tooth structure. It's literally just a tweaking, a recontouring, a changing the shape, and you know, using our artistic eye to kind of tweak things slightly. And not only is it less invasive, you know, people don't necessarily have the budget for a full mouth makeover, and honestly, a lot of people don't need it. So it's a simple tweak, a little recontouring here, there, moving some teeth, whitening some teeth, and my happiest patients, hands down, are the ones that go through this Cosmetic Dentistry Lite process, because no longer is it, you know, all or none, and the fear gets taken away, the cost hurdle gets taken away, the time hurdle potentially gets taken away. In some cases, you know, in an hour, you've got a whole new smile, and there's no anesthetic that we use. We're just recontouring teeth, and the results are unbelievable. And I think that's really sort of where our practice has found a little niche in the cosmetic dentistry world, which is, you know, of course we can do veneers, and when we do them, we make them natural, but it's not the right fit for every patient. And I think people are just looking for an enhancement or an improvement with their own teeth that looks natural. And this Cosmetic Dentistry Lite concept that we've come up with, I feel like is a perfect thread the needle in the world of cosmetic dentistry, and it's really, I think, what patients in our area are looking for. So, I think the hardest thing is educating patients. Anyone we talk to about this understands why it would be so appealing and why, rather than going through a whole process, they can really have an enhanced smile improvement for a lower cost, for less of, procedure, invasiveness, and the results are unbelievable. I mean, you've seen some of these cases. It's like before and afters, it looks like they had a whole smile makeover, and all we did was move their own natural teeth, whiten a little bit, and the biggest thing is that recontouring at the end, and it's night and day. And I'm more than anything excited for these next few years of, just as more people kind of catch on and realize that there's an in-between option, and being able to change people's lives, but not a total overhaul. So I think it's going to be awesome as we kind of take this path and really fine-tune this process that honestly no one else is really doing.
So who would be an ideal candidate for Cosmetic Dentistry Lite?
Honestly, I think it's anyone, right? I think everyone wants to look a little bit better. I have so many patients that come in and they say, I was looking at this photo and this tooth's a little dark, or this one's a little long, or, I think I need veneers. And the thing is that's not necessarily the case. I think anyone who just wants a smile improvement without too big of an investment, without going through too much, I think it's really anyone who wants to tweak their smile and improve it. And we're kind of in this social media world where, everyone's seeing themselves on camera and on Instagram and on TikTok or whatever the kids are doing these days more than ever. And, a big thing we saw was with COVID was everyone's doing Zooms and they're seeing themselves so much more. And I think, the little subtle improvements that we're able to give, I never want, and we've talked about this, I never want someone to ask one of my patients, who's your dentist? I want them to look at their friend and say, did you, change your hair? Did you lose weight? Did you, there's something different about you. You look great, but I don't want them to know it's their teeth. And I think by going through this process, we can make these little tweaks and give that to the patient where, they just wanted those little improvements, but they didn't want to go through a whole procedure process, and they want their own teeth to look natural. And so I really think anyone who wants that improvement is an ideal candidate. The best thing that I've seen is when a wife comes to me and says, you got to fix my husband's teeth. And that husband wants nothing to do with it, and they don't want to spend the money, they don't care, they want to look the way they look, and they want to look natural. Those are the best patients, because I think they're the ones who, might be willing to go through a little non-invasive process just for a little improvement. And when we do that and, they see the change that happened on not a whole lot of dentistry, not a whole lot of cost, it's not only are they happy, but their wives are really happy when that happens. So that's what I love. I mean, I love the ability to take, an interesting case where it's not overly complicated, but we can be creative in solving the solutions very conservatively, and again, just enhance the smile versus a total makeover. And I think that's a solution for anyone. Anyone would want an improved smile. So I think it's going to totally change the way dentistry is looked at and done, and open the door to people who think cosmetic dentistry is all or none to, can it be done at an easier, less costly, less invasive process.
So what kind of procedures are involved with Cosmetic Dentistry Lite?
If we're talking like what's in our toolkit as far as this goes, often what we'll do is Invisalign to get teeth into a better position. And Invisalign is not what people often think about when they think about braces or orthodontics. You know, when we're talking about doing it with the tweaking that we are, Invisalign really can be a very quick process. So it could be just a few months just to get teeth slightly in a better position, and not as involved as one might think. We'll do some whitening to enhance the shade or the color of the tooth. And then we've really got two options from there, which is we can add a little bit if we need to lengthen some teeth. And we can do that with just some simple bonding. So instead of jumping to porcelain and doing veneers specifically, you know, a tooth might just have a little jagged edge to it. And if the tooth is too short, we need to add a little bonding, right? If the tooth is too long or has jagged edges or doesn't fit within the smile line, all it is just a little, we call it aesthetic recontouring, which is basically we smooth off the surface of the edge of the teeth. And if you look at a lot of people, especially as we get older, teeth start to crowd together. And as they do, they form these sharp edges, right? And then you start hitting them against the top teeth and you start chipping those teeth. And we see this a lot in an aging population as we're living longer and longer and longer. You know, how many people don't wear their retainers from when they had braces, right? So a little bit of crowding, jagged edges, teeth start to chip. Well, if we can smooth those teeth out, right, and align and smooth the top teeth out, again, with or without Invisalign, just doing some smoothing with, you know, our hand pieces and getting things in a better position, two things happen. One is aesthetically, we can get all those edges to fit within a natural smile, which is great. Lower teeth, as we age, gravity takes over, so it starts to pull your upper lip down. You show less of your top teeth, more of your bottom teeth, and if they're crowded like this, that's all people see. So if we can get those aligned, not only are we making a huge aesthetic improvement, but now functionally, so when people are moving their teeth against each other, no longer is it sharp edge to top teeth that's going to start chipping things, but now you've got a really smooth movement. And so not only does it look better, but it's going to last longer. Teeth aren't going to break as much. And so it's really marrying those two sides of aesthetics and function. So, you know, I don't just look at it as a cosmetic improvement. I look at it as we're going to make things look better, but we're also going to make them work better and last longer. And I think that's such a huge key to what we do is taking the bite into account, and improving the aesthetics while also improving the function and the balance of people's bite. And I think, you know, by taking those few elements, whitening, aligning teeth with something like Invisalign, the aesthetic recontouring, and a little aesthetic bonding if needed, it's a huge small improvement from an aesthetic standpoint and a functional standpoint. And I think it's just an incredible, you know, incredible thing that we have to offer.